And it's time for Morning Rounds.
It sure is, and we are joined now by Dr. Alex Harrison, and it is Heart Health Month, which makes it appropriate to have a cardiologist here this morning.
Yes.
Thank you. Thanks for having me.
With the news with Dick Cheney as well brings some attention, and President Clinton.
Yeah, Clinton a few weeks ago and Cheney yesterday. It's definitely, we're wrapping up February, but February is Heart Month, but I'd like to reiterate that should be something we should focus on all year round.
Yeah, that is for sure.
Yes.
And in your diet, in your exercise, the heart really, it's all aspects of life, right?
Can't live without one.
No,
Yeah.
no, you can't.
No, you can't. And keeping a healthy one is really relatively easy. I mean, it's not like you have a book this thick telling you what to do. There's just some simple basics, right?
Well, in terms of what the viewers need to know, they really need to just be smart, don't smoke, eat healthy, live a healthy lifestyle, exercise, be active. But the biggest thing is preventative maintenance and seeing your doctor and making sure that your blood pressure and your cholesterol and your blood sugars are all okay, because those have been coined the silent killers, because you feel fine when you have these problems for years on end until you come in with a heart attack or stroke. And all too often I see patients that say, I've been healthy, I just haven't seen a doctor in 20 years, and then I see them when they're presenting with a heart attack in the hospital. So.
Right.
Do you think that people tend to just say, oh, I'll go later, or, if I have a little discomfort, oh, it's not that big of a deal, the doctor will not take me seriously. Do you think people put it off for some of those reasons?
I think people are just, they don't view it as a preventative maintenance. I mean, they're very good about taking their car in to get the tires rotated, getting the oil changed, and it's important you do the same thing for your body. Even though you may feel fine, there may be some things that are going on, these so-called silent killers that you need to check for and are very treatable and preventable.
Sometimes when I'm shopping at wherever it might be, I see people really going over the pet food thing for their pets as to, well, what's in this, and all that sort of thing. I don't see them doing the same thing as often with the food they're putting in their own bodies.
Right. No, I think that's very true. They're fearful of the animal byproducts and that big scare we had a few years back.
Food.
Right,
Yep.
exactly. But you're correct. I see very few people putting influence and stock into what they're putting in their own mouths.
So we need to focus on ourselves too.
Exactly.
Of course, former Vice President Dick Cheney's been in the news with now number 5 heart attack.
Yes.
Starting when he was 37 was his first heart attack. We have some video of this is the hospital where he's supposedly going to get released today. But what can you tell us about his situation?
After 5 heart attacks, is there just an incredible amount of damage done that's not repairable?
Well, it's hard to know. I mean, they haven't released all the details. A heart attack can be anything from a mild chest discomfort and a small amount of heart muscle damage done to a very large amount of heart muscle damage. And so if he's had 5 heart attacks, I imagine some are much smaller than others. But the fact of the matter is coronary artery disease is a lifelong disease and something that needs to be addressed and treated all the time. He underwent bypass surgery years ago, and he likely has a very weakened heart muscle because he has a special kind of pacemaker implanted called a defibrillator. And those are implanted in people who have had heart attacks and have a weakened heart muscle and are prone to life-threatening heart rhythms, and those defibrillators can be potentially life-saving in those circumstances.
Over to President Clinton now, who was very fortunate to be close to a top hospital when he had his heart problems a week or so ago. They chose to put a stent in, but I know that there's been some controversy surrounding that method in recent years, and the pendulum's kind of swung one way and then the other, and where do we stand now with using stents?
No, I think stents are very much the standard of care. It's just the type of stents you need to be very cautious in choosing which type of stent you put in and for which patient. There was the influx of drug-eluting stents, which prevent scar tissue and the foreign body reaction that the body has that re-narrows that artery where the stent has propped open and scaffolded to open that artery. And the drug-coated stents prevented that scar tissue. But what the trade-off is you need to be on blood thinners, aspirin and Plavix, to prevent that stent from clotting off. And if you stopped those medicines too soon, say for an elective surgery, that stent could clot off and you could have a massive heart attack. And so the non-drug-coated stents, or called the bare metal stents, then became much more in vogue because of the fear of this clotting off of the drug-coated stent. But research has shown that the drug-coated stents are very safe. You just have to be implanted in the appropriate patients, and they really have to be warned and educated about the importance of taking their aspirin and their other medicines like Plavix or this new drug called Effient to keep that stent open and prevent it from clotting off.
All right.
All right. Well, Dr. Alex Harrison, thank you so much. A wealth of information, so it's good that we're going to have you back, and we'll be focusing on...
I look forward to being here every other Wednesday with you guys.
We will be focusing on heart health, and you can send in your questions, morningteam@kcoy.com, and then Dr. Harrison will address these on air and give you some answers.
That's right. Thank you, Doctor, for being here. Nice work, and we're back in just a moment.